Hi, I'm Tony from Alibaba Damo Academy. Multimodal medical image registration aims to establish anatomical correspondence between multimodal images. Determining anatomical correspondence between multimodal images is crucial for medical image analysis and clinical applications. Complementary anatomic and functional information from multiple modalities can be obtained for precise diagnosis and treatment. Triple phase CT and dynamic contrast enhanced MRI are two of the most effective imaging techniques for achieving the diagnosis of suspected HCC lesions. Since multi-phase CT images are acquired from different time points, multi-phase CT registration is often required to eliminate the misalignment of the multi-phase images due to the body motion and organ deformation. In general, multimodal registration methods can be divided into three categories: deep learning-based, statistical-based, and structural representation-based. However, most of the deep learning-based methods are focused on the monomodal registration settings and rely on intensity-based similarity metrics such as normalized cost correlation and mean squared error, which are not capable for multimodal registration. Besides, using mutual information (MI) to perform rigid multimodal registration is common in the literature. Nevertheless, MI-based similarity measures are sensitive to locally varying noise distribution, but not sensitive to the subtle anatomical and vascular structures. As an alternative to the methods above, structural image representation approaches have gained great interest for deformable multimodal registration. By computing the intermediate structural image representation independent of the underlying image acquisition, well-established monomodal optimization techniques can be employed to address the multimodal registration problem. However, we find that such local feature descriptors are not expressive and discriminative enough to cope with the complex anatomical structures in medical images, as shown in the figure. To address the limitation of existing methods, we propose a modality-agnostic deep structural representation network and contrast deep learning paradigm to learn a deep structural image representation for multimodal registration. Our proposed network comprises of three major components: feature extraction, deep neighborhood cell similarity, and feature squeezing. The feature extraction module uses a 3D CNN to extract the image features. The deep neighborhood cell similarity module captures the internal geometric layouts of local cell similarity at the feature level of the image. And finally, the feature squeezing module encodes the high-dimensional 5D feature map into a compact 4D DNS descriptor. To further enhance the discriminability of deep structural image representation, we introduce an anatomy-aware contrast deep learning paradigm. First, we simulate the intensity distribution of the anatomical structures and/or lesion across multimodal scans by applying this stochastic nonlinear intensity augmentation to the input image. Then, our network learns to maximize the similarity of the deep structural embedding of the input image and that of the augmented image at the identical anatomical locations, while penalizing the similarity of that from different anatomical locations. We extensively evaluate our method on three multimodal registration tasks, including multi-phase liver CT registration, abdomen MR-CT registration, and brain MR-T1-T2 registration. We demonstrate that the deep structural image representation can be used with instant optimization and deep learning-based registration methods. Both methods with DNS achieve the best overall registration accuracy on multi-phase liver CT registration, outperforming three conventional registration methods and two SOTA learning-based methods. Moreover, our method is also robust to large deformation in abdominal CT MR registration. Registration methods using MI or MNI such as ENS fails to align the large nonlinear misalignment in the MR-CT task. Our method capable of aligning tumor regions of multi-phase CT and anatomical structures in MRI to CT and MR T1-T2 tasks without the need for a dedicated optimizer. As shown in the heat map of the feature similarity, our deep structural image representation produces less ambiguous similarity than my feature on tumor boundaries and anatomical structures. Thanks for watching.